Why do TB skin test results take 48 hours? Imagine getting a small shot under your skin and then waiting patiently to see if your body reacts. That's exactly what happens with a tuberculosis skin test, also called the Mantoux test. The reason it takes about 48 to 72 hours for results to be ready is because of how our immune system responds. When the test is done, a tiny amount of a substance called purified protein derivative is injected just beneath the skin. If someone has been exposed to tuberculosis before, their immune system has already seen the bacteria and remembers it. This memory causes the immune system to react, but this reaction doesn't happen instantly. It takes time for immune cells called T cells to recognize the injected substance and gather at the site of the injection. These cells then produce a localized swelling called induration, which is a firm, raised bump. The swelling is what health care providers measure to determine if the test is positive or negative. The reason for the 48 to 72-hour window is that this is the optimal time for the immune response to develop fully. If the test is checked too early, the swelling might not have formed yet, leading to a false negative result. Conversely, waiting longer than 72 hours can cause the reaction to fade or change, making it harder to interpret accurately. During the reading, healthcare professionals focus on the size of the induration, not just redness or skin irritation. They measure the diameter of the swelling in millimeters. The size considered positive depends on the person's risk factors for tuberculosis. For example, a smaller swelling might be enough to indicate infection in someone with a high risk, while a larger swelling might be needed for someone at lower risk. This timing is carefully chosen to balance sensitivity and specificity, meaning it helps catch true infections without overreacting to false alarms. If a person misses the 48-hour window, the test might need to be redone to ensure accurate results. This process helps doctors decide whether someone has a latent or active tuberculosis infection and guides further testing or treatment. In the end, the 48-hour wait is all about giving the immune system enough time to show its response clearly. It's a simple but crucial part of diagnosing tuberculosis accurately. Always remember, if you're getting a TB skin test, follow your healthcare provider's instructions and return within the recommended time frame for the best results. And of course, for any concerns or questions, consulting a healthcare professional is always the best step.